I'm Andrew Mellon, Vice President of Medical Informatics at Surescripts, and it's great to be here today in the Interoperability Showcase. I'm really excited to talk about how the Surescripts Network Alliance, our partners and the health technology vendors, the pharmacy benefit managers, pharmacies all came together to solve a really important problem facing healthcare today around medication pricing for patients. I'm now going to ask each of my colleagues to introduce themselves, tell us a little about yourself and your organization, and more importantly, just help us understand from your perspective what price transparency means and why is it important that we're acting on it now. But Jill.
I'm Jill Helm. I work in the Clinical Workflow Solutions Group at Allscripts. We're an EMR vendor representing about a little over 180,000 physicians across the country. What price transparency means to us is having that information that has historically been available at the pharmacy counter and moving that upstream into the clinical workflow where the prescribing decision is made. And so not only information about cost, but also actionable information about what the prescriber and the patient can do to change that cost, whether that be going through a different delivery channel, such as home delivery, whether that be prior authorization, therapeutic alternatives. It's having that information available to the physician while they're prescribing. It really enables the physician to touch that patient once and to get the prescription correct and avoid those phone calls and faxes from the pharmacies on the back end.
Now, Jill, you've been our partner as we've rolled this out to Allscripts EHR users. And I know you've talked to many physicians using this, and just give us a sense of how's this changed the way the providers have said that they interact with their patients?
Yeah, absolutely. This has been received very positively by our physicians. We did a recent survey with our group of users that are using the price transparency, and we found that 93% of our physicians reported that their patients had actually saved money by being able to utilize the information within price transparency. Yeah. And that's good for the physician as well as the pharmacy. But even more than that, actually over 50% of the physicians felt that it saved them time because they weren't getting those phone calls, they weren't getting those faxes after the patient had already left. And over 85% of the providers reported an increase in overall patient satisfaction. So I think better adherence, more satisfied patients, and a better healthcare experience, to me, is a win-win all around. Historically, physicians to some degree have had pricing information. I've had an opportunity to go to some of our customers and seen sticky notes on the side of the computer, right? Everybody knows who has the $2 generics, right? Who has the zero-cost prescriptions. That's now bringing this information in to the EHR application in real time. So our physicians have been very, very pleased with this, and we're looking forward to expanding it even more.
That's great. Something you said there, Jill, you said time. 50% of doctors said this is saving them time. And absolutely. I was at a talk with Amdis yesterday. They gave one of their sessions was about physician burnout. Yeah. And time is really one of the biggest or most precious thing that a provider has. And we talked about that yesterday. Anything to give the doctor back time.
Even in the cases where those medications are very expensive and the patient's out-of-pocket cost is very high, then there's an opportunity for the physician to get involved as well, looking at other ways to potentially reduce that cost, patient affordability programs, charitable foundations, others. But you have that opportunity with the patient there to have those discussions about those alternative payment mechanisms that you really can't have if the patient is at the pharmacy. We have physicians. I was recently visiting one of our physician practices in Ohio where a physician in urgent care had to spend over a half an hour on the phone with a just waiting to get the community pharmacist on the phone to have a conversation about the prescription. So it's that type of time right now that I consider to be wasted time out of the physician's day, that price transparency has changed all of that because the information is presented within the workflow to the practitioner without any added clicks. It's just there for them to look at, right? And so they can start to see some of those big gaps in prices and really improve the efficiency of the practice of medicine, as well as create more satisfied patients and speed to therapy.
Yeah, I think that's a great story, and something that I've strived for over my career is how do you eliminate rework, right? How do you get to do things right the first time? And, that's a real challenge. I mean, what I see is provider offices hiring more staff because they're spending more time on rework and redo. Great, thank you. Jill?
Sure. So for those skeptics that are out there, I would share that price transparency is real. It's one of those features that is really available in the EHRs today. There's many health plans that are already sharing price transparency information, and more that are starting to share that information every day, that the information is actionable and that it's accurate, and that it can really save the physician and the physician's practice time and money.
First of all, thank you very much. There were obviously lots of good things that came from this discussion from the perspective that we're talking about consumerism, decreasing physician burnout, as well as leading to value-based healthcare. Those are all really great things we heard about this morning. To see them come together in this area is awesome as well. When talking about all of the data points that can be made available to a physician at the point of care, that I think to myself, there's probably a fine line between helping and the burnout question. So I'm interested to know what your thoughts are in that regard. Where do we pull the plug on more data being helpful versus less being what we want? So I'll just let you guys answer that.
So just let me add to that. So I think from my perspective, a couple things. One is it's about collaboration. And I really want to recognize Surescripts as being a leader in this space and being a collaborator and a convener. So we can have PBM health plan representation together with EHRs, with physicians to really talk about those discussions and how much data do you present, right? Particularly in the area of alternatives. Do you present 3 to 5 or do you present 50, right? And then the other thing to really think about too is what's the information that a practitioner is going to need to see 90% of the time, and then how do you enable access to that deeper information that 10% of the time where it really matters, right? And in cases like that, maybe it is a click away. Maybe you do need to scroll, right? But you have that information that's actionable without making the user do an extra step. And that's how you achieve your results.
Hi, question for the panel. So this morning, Governor Levitt mentioned the Karen Alliance and how they're working on opening up data for patients. So we're actually running a new work group to look at offering real-time benefit check for patients. So I'm curious to hear from the panel if you, first of all, think it's a good idea, and second of all, if you do, if there's any kind of hurdles or obstacles you see about opening this up to the patient.
I think just to briefly echo, we're very supportive as well as having the patient information in our patient-facing applications. I think one area where it really can benefit is as prescription prices change over time, it can be really powerful if patients know that a medication that was affordable 6 months or a year ago now is not as cost effective, and then they can have that conversation with their physicians when they go in for their checkup. So I think having that information ahead of time is really powerful as well.
I think we're seeing some trends in legislation that are appearing to protect that point of sale discount to patient. What I think has traditionally been missing from some of these services in the EHR that are showing prices to doctors is they're not including necessarily manufacturer support for patients. Are there plans to include some of those things in these services moving forward so the physicians are seeing a manufacturer direct-to-patient savings as well?
And just speaking from an Allscripts standpoint, we're very much committed to creating price transparency, creating that visibility to patient affordability options, right? And welcome as much information as possible into the conversation between the physician and patient.
I'll just say we're continuing to explore other areas to improve some of the other topics we talked about. So our time is up. So I want to thank my panelists for their discussion and answers. That's great and informative, so thank you very much.
Thank you.